Have you ever really thought about it? What actually happens when a doctor tells you to count backward from 10 and you're gone? Well, today we're pulling back the curtain on general anesthesia, a medical marvel that millions of us experience but very few of us truly understand.
Right? It's such a simple question, but it's also incredibly profound. You're there 1 second, and the next, you're not. So what exactly is that state of not there? Let's follow the incredible journey your body and brain take when you go under.
So, first things first, let's be clear. General anesthesia isn't just a really deep sleep. Not at all. It's a very specific, very controlled medical state. The whole point is to achieve two key things: to make you unconscious and to make absolutely sure you feel no pain.
To really wrap our heads around how anesthesia works, we first have to understand what it's trying to accomplish. You see, it's about way more than just knocking you out. It's about creating the perfect conditions for a successful surgery.
It really boils down to two main jobs. The primary goal is the one we all know: a complete loss of consciousness and, crucially, no pain. But there's a secondary goal that's just as vital: muscle relaxation. This is an absolute game changer for surgeons because it prevents even the smallest involuntary twitch that could complicate a super delicate procedure.
Okay, so how do these powerful drugs actually achieve all this? Well, let's trace the path of the anesthetic from the moment it enters your body all the way to your brain.
For the anesthetics you breathe in, the journey kicks off in your lungs. It's a bit like filling a tire with air. The pressure of the gas literally pushes the anesthetic molecules from your lungs right into your bloodstream. And from there, it's an express train, with the final destination being your brain and central nervous system.
Now you might be wondering, why the brain? Why does it get hit first and hardest? Well, it comes down to two simple reasons. First, your brain gets a massive share of your body's blood flow, so the drug gets there super fast. And second, the brain is very rich in fatty tissue, and these drugs are specifically designed to dissolve in fat. That 1-2 punch makes the brain the primary target.
All right, so the anesthetic has arrived at its destination. Now the really fascinating part begins. It starts this carefully managed process of shutting down the brain, and it does it in a very specific order, from the top down.
This is where it gets so cool. Anesthesia doesn't just, flip a single off switch in your head. It's much more sophisticated than that. Think of it more like a controlled shutdown, taking different parts of the brain offline in a predictable sequence.
A great way to think about this is to imagine your brain has different departments. You've got the higher centers, kind of like the executive offices that handle consciousness, control, and coordination. Then you've got the lower centers, which are like the building's maintenance crew, running all the basic automatic reflexes. Anesthesia sends the executives home first.
In this top-down shutdown actually explains a really common thing you might have heard about. With the executives offline, sometimes the maintenance crew can get a little rowdy on its own for a moment. And that's why some patients might have some involuntary movements right as they're going under. The control centers are offline, but the deeper reflexes haven't quite gotten the memo yet.
Now, this shutdown process isn't just a free-for-all. For over a century, anesthesiologists have used what you could call a depth map to navigate these different stages and know exactly where their patient is on this journey.
This classic framework is called Goodall's scheme. It's basically a roadmap that lays out the signs and symptoms for each level of anesthesia, telling the doctor precisely how deep a patient is at any given moment.
And this map has 4 distinct zones. Phase 1 is analgesia. That's when you start feeling drowsy and your pain is reduced. Phase 2 is the excitation phase. That's where those involuntary movements can happen. Phase 3, surgical anesthesia. That's the sweet spot, the target depth for the operation. And Phase 4 is overdose, which is the danger zone that every anesthesiologist is rigorously trained to stay far away from.
Now, while Goodall's scheme was revolutionary, modern anesthesia has evolved quite a bit. Today, it's less about this one linear journey down a depth map and more of a sophisticated, real-time balancing act.
See, nowadays, instead of using just one drug to take a patient all the way through those 4 phases, doctors use a cocktail of highly specialized drugs to achieve 3 specific goals all at the same time.
This modern approach is known as the triangle of anesthesia. It's so elegant. You have 3 points to hit: hypnosis, which is the loss of consciousness; analgesia, the loss of pain; and muscle relaxation, which is the loss of reflexes. By using different drugs that are experts at each of these jobs, anesthesiologists can create a completely customized anesthetic plan for every single patient. It makes surgery so much safer and more effective than ever before.
When you think about it, anesthesia is this incredible, guided tour to the very edge of consciousness and back again. It's truly a cornerstone of modern medicine, and it leaves you with this really deep question. As we get better and better at temporarily turning consciousness off, what does that teach us about what it really means to be turned on?